During my PD time, I worked as a postdoc fellow in Mike Longaker's lab and in the Division of Pediatric Surgery here at Stanford. And I studied spatial transcriptomics, genomic sequencing, and uh, surgical applications to surgical applications of fibrosis. I was also the Pediatric Innovation Fellow, and I worked on clinical projects with the Division of Pediatric Surgery, and I took some call with the division. When I was going into my research time, I reached out to my mentors at MGH, and I asked them, I'm interested in pediatric surgery, I'm interested in basic science, what kind of labs are there throughout the country where I might be able to better gain some skills in basic science research and translational research. And Dr. Longaker's name was one of the first that came up. So when I reached out to him, we had an interview, and it was kind of set in stone from there. And when I told Dr. Longaker I was interested in pediatric surgery, he was very supportive of me working with division here to get to know the faculty and also to work in more clinical projects. For my PD time, it was primarily funded by two research sources. I got the American College of Surgeons Resident Research Grant, which paid for half of my salary, and then the other half was covered by the Stanford Transplant and Tissue Engineering grant that was provided through Stanford. In working in the Longaker lab and working with all the incredible scientists and postdocs that I've come into contact with, I think by working in this lab, I developed an intuition and the skills and the techniques that are necessary to conduct my own basic science research. And by working in the lab, it kind of showed me like, wow, you're capable of doing this. And my interest is in being a pediatric surgeon scientist. So having worked in the lab for 3 years, I feel like this has given me the training to be able to do that, to be able to work on my own one day and work on problems that I'm passionate about. I think working at Stanford and working in the Longaker lab, working in the Hagee building has been incredibly transformative. It can take like a general surgery resident like me that didn't have a basic science background and help me learn the skills and learn the techniques to be able to ask questions that I'm interested in. And I think that that's been a really transformative experience to me. And what I would tell other residents is that it's possible. You don't have to come into the lab with an extensive background in basic science research or a PhD, that you can learn these skills and you can study what you want to study and get the skills that you need to do so.